I chose to do my course project on hepatitis B. Hepatitis B is an inflammation of the liver caused by the virus. It is more infectious than the AIDS virus. Hepatitis B virus, HBV, attacks the liver cells and can lead to cirrhosis, liver cancer, or liver failure if it's not detected or managed. How it affects the liver. These are some examples of the liver. One is fibrotic liver. The continuous inflammation of the liver caused by hepatitis B can lead to fibrosis. You have a cirrhotic liver, which is in cirrhosis of the liver, scar tissue replaces normal healthy tissue, blocking the flow of blood through the liver and preventing it from working as it should. The last one shows liver cancer. It is the formation of a malignant tumor in the liver. How hepatitis B affects the liver functions. With a hepatitis B infection, the liver is under constant attack. It eventually becomes hardened, causing cirrhosis. If cirrhosis becomes severe, liver failure can then occur and will no longer be able to produce clotting factors that is needed to stop the bleeding. The liver will also stop filtering waste, toxins, and drugs from the blood. Symptoms from hepatitis includes fever, fatigue, muscle, joint pain, a loss of appetite, and mild vomiting and nausea. Between 30 to 40% of people infected do not experience any noticeable symptoms. If they do occur, they do so within 4 to 6 weeks after becoming infected and can last from 1 to 2 weeks to several months. Hepatitis B is known as a silent infection because many won't find out when they become infected, since there are no common symptoms at first. Symptoms to not ignore and get immediate attention are yellowing of eyes, skin, also known as jaundice, bloated stomach, and severe nausea and vomiting. If you think that you may have come into contact with an infected person, it is best to receive a vaccination within 12 hours to avoid contracting it. For acute hepatitis B infection, there is no treatment necessary. It is short-lived, meaning it will go away on its own. If within 6 months acute hepatitis B is still present, then chronic hepatitis B is possible. Treatments with chronic hepatitis can help you avoid liver damage. Medication for chronic hepatitis includes Epivir, Hepcera, Tyziga, and Entecavir, also known as Baraclude, which is one of the newest drugs for Hep B. You can take it as a liquid or a tablet. Another way to treat infection is to receive an interferon alpha 2B injection. The needle is used on mainly younger crowds that do not want to go through with the long-term treatments, or that may become pregnant in the next few years. If you have been exposed, see your doctor within 2 weeks, and they'll give you a vaccine shot of hepatitis B immune globulin, which boosts your immune system and helps you fight off the infection. Side effects are possible with the treatments. It includes depression, difficulty breathing, and some chest tightness. In most severe cases, a liver transplant may be needed as if the liver is severely damaged. There is no cure for hepatitis B. It often goes away and occasionally disappears in people who have a chronic case. Prevention. To help prevent the disease, practice safe sex. Use condoms with your partner, and avoid any direct contact with blood or bodily fluids. Cover all cuts and make sure to wash your hands often to prevent any potential exposure to the disease. Make sure you do not share any razors, toothbrushes, or nail care. And these are a few of the references I used during my project.